So this is chapter 24. This is physical activity at medium and high altitudes. And this chapter is actually pretty important, especially in the context of living in Alberta, where we actually have a lot of different altitudes. Now, you guys probably aren't aware of this, but Medicine Hat's actually a relatively high altitude for being on the prairies. We're actually one of the more elevated areas on the prairies. But it's also apparent if you were to go do training in Calgary, for example, or Canmore or Banff, where lots of athletes actually train out of because they're at a higher altitude and it will help them create some adaptations. So we're going to learn about that in this chapter. So again, I'm skipping over the chapter objectives. You guys know the jig with this, so I won't spend any time here. So we are going to start with the stress of altitude. Now, we need to define what high altitude is, and high altitude can vary anywhere between about 3,000 and 5,500 meters above sea level. Now, why does altitude get more challenging when it comes to training? Well, it's because of the direct decrease in ambient pressure of oxygen. So it's actually the amount of oxygen that's available at a particular altitude. Now there's a few terms that you guys are going to want to be aware of as we start out here. So we're going to talk about the oxygen transport cascade, and this refers to the progressive changes in the environment's oxygen pressure and body areas. So you're going to see that as there's less available oxygen in the atmosphere, this oxygen transport cascade can get stressed. You're also going to see the term acclimatization, and acclimatization is referring to adaptations that happen in the natural environment. So if you were to go up into the mountains, let's say at Banff or in Jasper, and you're trying to train in those environments, those natural environments, you are going to get acclimatized to that environment over time. Acclimation is adaptations that happen in a lab environment. So if we put a mask on you that made it more difficult for oxygen to come in, and we kind of tried to reproduce some of these natural environments in the lab, that would be called acclimation and not acclimatization. So as we work at higher altitudes, we start to see this decrease in the oxygen pressure, which ultimately results in this phenomenon called arterial hypoxia, which means there's less oxygen in the arteries. And usually we actually see this pretty consistently just immediately as you start to get into that new altitude or that higher altitude. And we also start to see it change over time, but it lasts for a long time until you start acclimatizing to that new environment. So here's a graph that shows the physiological changes with increase in altitude. So on the red line, we see all these different cities. And then we have Mount Everest way at the top, which is obviously the highest point. And then we have this pressure in the arteries of oxygen, so this PaO2. And we're going to focus on that a little bit more because it can show you guys that with increased elevation and altitude that it's much harder to keep this towards 100%. And the reason that happens is because it's actually there's less pressure from the atmosphere that's pushing oxygen into our lungs. So you can see on the right side of this table that the pressure at sea level of oxygen is actually significantly higher than when we get to these higher altitudes. So we're not getting that outward pressure pushing oxygen into our lungs and keeping that saturation of oxygen high. Another thing you'll see on this graph in this table is we got this dotted line, and that's the upper limit for permanent residence. So that would be the highest altitude that you could live at that would be sustainable, that you could actually habituate to over time. And then one more thing that you can see here is we have this A, B, C, D, and E over on the left-hand side here. And it shows you guys different symptoms that people might experience at different levels of altitude. So you can see even just at not super high altitudes, you'd start getting lightheaded, you have a bit of a headache, and then that just progresses on and on and on up to the point where you're climbing at these super high altitudes like Mount Everest, and there's almost like impending collapse. Like every step is going to be so challenging because you're not getting those high levels of oxygen going into your bloodstream and going to your brain. So it just gets more and more challenging the further you go along with altitude. Okay, so here's the oxygen transport cascade from sea level to 4,300 meters. So you can see this is our pressure of oxygen, okay, and we have this um, much higher level pressure with inspired air. So the air has enough pressure to push into our lungs, versus at 4,300 meters, it doesn't have as much. So it's more difficult to get oxygen in because we don't have that outward pressure pushing in. And then they just break this down into like alveolar gas, arterial blood, and mixed venous blood. Um, and they're basically just identifying different areas in the circulatory system where we might see this change in the oxygen transport cascade. So oxygen loading at altitude. So there's only a small change that occurs in hemoglobin percentage saturation with oxygen until an altitude of 3,048 meters. And we talked about that 3,000 meter number being the number that kind of indicates when it gets more difficult to saturate the hemoglobin. So moderate altitude work does not impair the capacity of the immediate and short-term anaerobic energy systems, and performance in single bouts of intense exercise improves due to the altitude's lower air density. In transition from moderate to higher elevations, the hemoglobin's oxygenation dramatically decreases and negatively affects mild intensity aerobic exercise. So you don't get affected too badly at moderate altitudes, but you can really get affected once you move from these moderate altitudes to higher altitudes. Now, acclimatization, we talked about this on a few slides back, but acclimatization is an adaptive response in physiology and metabolism to improve the tolerance to altitude hypoxia in that particular environment. So if you were to go up to the mountains in Canmore or Banff, that would be the environment you'd have to exercise in order to acclimatize to it. So full acclimatization requires an appropriate time period, so it does take time, and successful adjustment to medium altitude affords only partial adjustment to higher elevations. So if you want to continue to acclimatize, you want to start at a moderate altitude and you want to slowly increase your altitude so that you can, progressively increase your tolerance to it. Okay, so we're going to look at immediate and long-term adjustments to altitude hypoxia. So how does your system change related to this decrease in oxygen in your system? So with the pulmonary system, we're going to see a change in your acid-base content. So we're going to get this immediate hyperventilation, which means you're going to be breathing faster. And what happens when you breathe faster is you actually suck more oxygen in than you breathe out carbon dioxide. So if you guys have ever hyperventilated in your life, you start to get a bit lightheaded. And what happens when you start to hyperventilate is that you end up getting decreased amounts of carbon dioxide in your system. And carbon dioxide is actually slightly acidic, and it helps maintain that proper pH in your system. So when that changes, you get this more alkaline effect in your system. So in the long term, you're still going to see this increased breathing rate, but what we're going to see is your kidneys are going to make up for that alkaline increase, and they're going to actually excrete some of that base material out of your system. Now with the cardiovascular system, we're going to see this increase in submaximal heart rate. We'll see an increase in cardiac output. See about a similar stroke volume, and we're going to see the maximum cardiac output stays about the same. Now you guys know cardiac output is heart rate times stroke volume, so you can kind of do the math here, and it ends up being about similar to what you were before. Now in the long term, we still see an increase in heart rate. We see a slight decrease in cardiac output, and we see a decrease in stroke volume. We also see that maximum cardiac output will decrease as well. So again, you guys can see this makes sense. If your cardiac output is stroke volume times heart rate, if your stroke volume goes down, but your heart rate stays the same, well, you're still going to get a decrease in your overall cardiac output. Now, in regards to your circulatory system, they didn't have any immediate effects here, but longer term, you're going to see decreased plasma volume, increased hematocrit, which makes sense with the decreased plasma. You're going to increase hemoglobin concentration and increase total number of red blood cells. And then locally to other systems, you might see increased capillarization to the skeletal muscle, increased red blood cells, increased mitochondrial density, increased aerobic enzymes in the muscle, and loss of body weight and lean body mass. So you guys should understand some of these adjustments. I would say trying to have a rough idea of what happens, maybe not being this specific, is important so that you guys know what kind of changes you should expect if you're working with an athlete or with a person who is living at a particular altitude and needs to know what type of changes they might see in their system. So what are the immediate responses to altitude exposure? We talked a little bit about this on the last slide, but this goes into a touch more detail. So when we get to these elevations of greater than 2,300 meters, we get this rapid physiological adjustment to compensate for thinner air and the reduction of alveolar pressure of oxygen. So you're not going to get this pressure from the outside pushing oxygen into your lungs. So what do we need to do in order to get more oxygen? Well, we need to increase our respiratory drive so we get hyperventilation. And then we need to increase blood flow during rest and submaximal exercise so that the tissues that need oxygen are getting them. So we need to improve the blood flow to these other areas. So hyperventilation, you guys already know what this is. I don't need to explain it, but it is the most important sign of someone who has come from a low altitude and now has arrived at a high altitude. So if someone who, for example, lives in Vancouver, goes up into the mountains at high altitude and they're used to living at sea level, and now they've gone up into Whistler, for example, up into the mountains, well, they're going to get this hypoxic drive, which is going to create hyperventilation. So once we start this hypoxic drive phase, it's going to increase this hyperventilation for the first few weeks if you're exposing this person to high altitudes, but it can remain elevated for a year or longer if you're exposed to these altitudes for a long time. Now, the increased cardiovascular response. Again, a couple slides back, we talked about this. So resting blood pressure increases in early stages of altitude adaptation, and submaximal exercise heart rate and cardiac output rise to 50% above sea level values, with stroke volume remaining unchanged. The increased submaximal exercise blood flow at altitude compensates for arterial desaturation. So when you're having less oxygen come into the system, we need to make up for it by having an increased blood flow so that that person can still get the oxygen that they need to the tissues that require it. So here's a comparison of oxygen cost at different altitudes. So we can see we have someone here who's doing some particular aerobic activity that's testing their VO2 max, and they're doing this at sea level. And then you have someone doing it at high altitude at roughly 4,300 meters. And you can see that the VO2 max at sea level is significantly higher because you have more access to oxygen from the atmosphere. And consequently, when you go to high altitude, you see this massive decrease in your VO2 max. And this is partially why people train at altitude, is they have higher stresses at altitude, and it allows them to, tap into that overload principle that we talked about without having to work insanely hard at sea level. They can go up into a higher altitude and train at those levels and achieve the same amount of work, if not more, at less intensity. So next we'll talk about catecholamine release or response. And catecholamines, as you guys remember, are those epinephrine, the norepinephrine, and those sympathetic hormones that we talked about a few chapters back. So this sympathetic adrenal activity progressively increases over time during rest and exercise with altitude. So we get increased blood pressure and increased heart rate at altitude, and they coincide with a steady rise in plasma levels and excretion rates of epinephrine. This increased sympathetic adrenal activity contributes to the regulation of blood pressure, vascular resistance, and substrate mixture during short and long-term hypobaric exposures. So hypobaric just means a decrease in pressure. So remember, we don't have that outward pressure of the atmosphere pushing oxygen into the lungs. Okay, so we're going to look at a couple metabolic and cardiorespiratory responses at sea level versus at high altitude at different intensities of exercise. So we got people who are working at sea level or 0 meters of altitude, and then we have others working at 4,000 meters of altitude. And you can see we have these different work rates. So all the way up to this maximum rate, we can see that the difference in VO2, there's a difference in VO2 max, especially at higher intensities. There's a difference of minute ventilation, especially at higher intensities. And there's a difference in arterial saturation. And this is obviously the most dramatic change. And I've put the pulse oximeter on you guys in lab, and you guys have seen that generally we kind of see these mid 90s to high 90s for values. But when we get to elevation, there's not that external pressure of the atmosphere pushing oxygen into our system. You can see that these oxygen values can decrease significantly during exercise at elevation. You can also see people are breathing a lot harder. So they're pushing out a lot more volume of air in a minute. They're inspiring and expiring a lot more air in 1 minute compared to at sea level. So here are the urinary norepinephrine and epinephrine responses during a short stay at high altitude. So you don't necessarily see these changes in the catecholamines of epinephrine, but once you get to altitude, the norepinephrine levels increase significantly. So we talked about how that sympathetic adrenal response increases with exposure to altitude. So here we're going to look at this minute ventilation, that VE, and our VO2 in relation to different altitudes. Now, if you guys remember, we don't start hitting that kind of high altitude or that moderate altitude levels until about 3,000 meters. So we're going to see how that really contrasts to when we get into these higher elevations like 4,000 meters. So if we look at sea level, you can see that our VO2 max is quite high, right? It's up to almost 4.5 liters per minute, which is pretty impressive. And we're getting this minute ventilation, this reasonable minute ventilation at about 160 liters per minute. And then we're going to start to see that as we increase the altitude, we're going to see this regression or this decrease in our VO2 max. But we will see that kind of at these moderate altitudes, like at 3,000 meters, you can actually see that your VO2 max drops off a little bit, but your VE or your minute ventilation actually increases. And that's because you're having to work a little bit harder and you have to blow out and suck in a lot more air in 1 minute in order to maintain oxygen levels. Now, as we increase the altitude and we get higher and higher and higher in altitude, and we go to 4,000 meters, you can see this significant drop off in VO2 and a significant drop off in the minute ventilation. Now this is happening because you're actually struggling now to get oxygen in, and it is very difficult to breathe. It's very strenuous, so you get this massive drop off in both categories. Next, fluid loss. So ambient air in the mountains remains cool and dry, so it's allowing body water to evaporate as inspired air becomes warmed and moistened in the respiratory passages. So fluid loss leads to moderate dehydration and accompanying dryness of lips, mouth, and throat. And fluid loss becomes more pronounced for physically active people because of the large daily total sweat loss and exercise pulmonary ventilation. So basically at elevation, you're getting more fluid loss because of how dry the air gets at elevation. If you guys have ever gone hiking, especially up in the mountains, you will know that as you start to get higher, not only is it getting a little bit harder to breathe, but you're also noticing that your mouth is getting super dry, your lips are getting dry, and it's just getting a little bit more difficult to continue on. And that fluid loss can get exacerbated, especially if you're trying to do like trail running up in the mountains, or you see people, I personally think this is crazy, but running up and down a mountain, they're going to get that excessive fluid loss. So next is arterial desaturation as a function of increasing altitude. So you can see whenever you see as a function, whatever's before that is on the y-axis. So arterial desaturation will be on our y-axis, and increasing altitude will be on the x-axis. And we're going to look at the impairment in diverse sensory and mental functions. So when you have this lower altitude, you're going to get this high oxygen saturation percentage, and you're not really going to see any sensory or mental function deficits. But as we start to increase the altitude, you're going to start to see a bunch of different changes in the sensory and mental function. So 1500 meters, we start to see light sensitivity. That kind of stays consistent, but as we continue on, we're getting these changes in cognition, we're getting changes in our visual tracking, our reaction times, being able to recall information, because our brain is actually under a ton of stress when it's not getting the proper amount of oxygen, or at least these higher amounts of oxygen that you would typically get at lower altitudes. So next, longer-term adjustments to altitude. So longer-term adjustments improve tolerance to relative hypoxia of medium and high altitudes. So it's just like training. We talked about this last chapter. We have to do this very progressively. We have to take our time with it. But over time, you can adjust. If you go from 0 to 4,000 meters all at once, you're going to be in trouble, right? It's not going to be a good time for you. So we have to take this a little bit at a time. So what are some of the longer term adjustments that we see? We see the regulation of acid-base balance of body fluids altered by hyperventilation. We talked about that on that first table a few slides back. You get the synthesis or the creation of hemoglobin and red blood cells, and the accompanying changes in local circulation and aerobic cellular function. So now you're getting this increase in hemoglobin, you're getting this increase in red blood cells, you get this increased hematocrit in your blood. And then third, you get this elevated sympathetic neurohormonal activity reflected by an increase in norepinephrine that peaks within 1 week. So we talked about that increased sympathetic drive that happens in relation to increased altitude. So we're going to revisit this acid-base readjustment. So we need to establish an acid-base equilibrium because your body needs to be at a particular pH in order to function properly. So we need to make sure that it stays at that level. Now what happens when you hyperventilate is you end up blowing off a lot more carbon dioxide. And carbon dioxide is actually acidic. So when you have less carbon dioxide in your body, you are less acidic and therefore you are more alkaline. So that's not going to work because that's going to throw off your pH in your body. And so we need to bring that alkaline level down, and we need to decrease the pH in our system. So the kidneys will actually make up for that by flushing out some of our alkaline reserves to keep our pH levels balanced. And that is really important, especially when you're hyperventilating, so that your system is functioning as efficiently as possible despite all the other changes that are happening in our body. Now at high altitude, submaximal exercise actually increases the blood lactate compared with sea level values. And the greater reliance on the anaerobic glycolysis with altitude presumably increases lactate accumulation because you don't have as much oxygen to help work your aerobic system. So you have to rely more on the anaerobic system at higher altitudes because there's not that oxygen that exists there. So after weeks of hypoxic exposure, so being at higher altitudes, the same submaximal and maximal efforts produce lower lactate levels. And this occurs despite a lack of increase in VO2 max or regional blood flow in the active tissue. So your body is just getting used to working at this level, and therefore you don't produce as much lactate at a certain intensity. Now, we talk about decrease in oxygen means that you have to rely on your anaerobic system a little bit more at altitude. Now, we usually think that when you have to rely on the anaerobic system, that that's just going to create more and more lactate at increased altitudes because you just don't have the oxygen up at those altitudes. However, there is an exception to the rule. So once you get past 4,000 meters of elevation, you actually see a general decrease in maximal lactate with intense exercise. And this is contradicting the rule of more or less oxygen and an increase of your anaerobic system use, creating more lactate. So there's actually this paradox that exists. Once you get past 4,000 meters, you'll actually see a decrease in lactate levels. So they've done some research to find out why does lactate actually decrease as we get past that 4,000 meter mark. And it seems to point to a decrease in epinephrine being passed into the system at chronic high altitudes. So when we're not getting that catecholamine release of epinephrine, remember that epinephrine is a glucose mobilizing hormone. So it actually helps get glucose from the liver and put it into our bloodstream. So when we don't have this glucose mobilization or this glucose coming from our liver, it reduces the capacity for lactate to form. So this is where when we get to those higher altitudes, we just don't get the epinephrine activity, and therefore we don't get glucose that allows us to create lactate. So we can see here, this is the lactate paradox. And we know now that beyond that 4,000 meter stage, we see this decrease in lactate. So they talk about your lactate levels here in millimoles, and we've got the altitude in kilometers. So 4,000 meters would be about here, and you can actually see that lactate's fairly high here. And then we see this massive drop off at these increased altitudes. So next we'll talk about hematologic changes, and this is essentially changes in our circulatory system. And we actually see an increase in the blood's oxygen carrying capacity at altitude, and this provides an important longer term adjustment to altitude exposure. So why do we get an increase in oxygen carrying capacity? Well, there's two factors that account for it. One is an initial decrease in plasma volume, which will inherently increase our hematocrit. And two is an increase in erythrocytes and hemoglobin synthesis. So if you guys remember, erythrocytes are red blood cells, and hemoglobin is what carries our oxygen. So getting an increase in that, or an increase in creation of these two things, is going to help us carry more oxygen. So here are the effects of altitude on hemoglobin and hematocrit. We're going to focus more on this top graph here because it's going to cover hemoglobin on the bottom in yellow and hematocrit on the top in red. And so pre-altitude, you can see what the hemoglobin, so it's the grams per deciliter, and then your hematocrit percentages at sea level, so pre-altitude. And then as they go to Pikes Peak and they spend some time up there, you can see as they spend more time at that elevation, that their hemoglobin levels increase significantly in grams per deciliter. So they go from basically 14 up to just beyond 16. And then with the hematocrit, you can see increases from about 43% all the way up to about 49 or 50% as they get about 2 months into their time on Pikes Peak. So a big change in a couple different aspects with our circulatory system. So we have some cellular adaptations that occur as well, and they include these six things in relation to altitude. So number one, you get remodeling of the capillary diameter and length. You get improved microcirculation to reduce oxygen diffusion distance between blood and tissue. So you get more capillaries at these tissues that allow oxygen to pass in more easily. You get increased myoglobin, so that augments your oxygen storage in the muscle. You get a small increase in mitochondrial number and concentration, and you get a slight right shift of the oxyhemoglobin dissociation curve. So it ends up just shifting off and offloading more oxygen. So you get better at extracting oxygen from the system. And then you also get this increase in 2,3-DPG concentration. And I wouldn't worry about that quite as much and try to understand these other ones. So next is body mass and body composition. So prolonged high altitude exposure reduces lean body mass. So you can get a 20% decrease in muscle fibers, and you get a decrease in body fat. So the magnitude of weight loss directly relates to the terrestrial elevation. So however high you are altitude-wise, that will determine the change in body mass and composition. So you're going to see a decreased appetite. So you're not going to want to consume as much calories. And then you're also going to see increased basal metabolic rate. So this is that rate that you guys have, and it's how many calories you burn, even if you just sat on the couch all day and just existed. So existing as a human being at higher altitudes just burns more calories. So what's the time required for acclimatization? Well, guess what? It depends, just like everything else we've talked about. And it depends on how high you go. And when you go to a certain elevation, the acclimatization only partially adjusts you for higher elevations. So if you went and lived at 3,000 meters, you would only be partially prepared to live at 4,000 meters. And it takes about 2 weeks to adapt to altitudes up to 2,300 meters. And thereafter, every 610 meter increase requires an additional 1 week. So for example, if you started at 2,300 meters, take you about 2 weeks to adapt to that. Then if you went to 2,910 meters, it would take you another week to get used to that. So athletes who compete at altitude should begin training immediately during acclimatization to minimize detraining effects. And acclimatization adaptations dissipate within 2 to 3 weeks after returning to sea level. So you can see there is a detraining effect to training at altitude. And so in order to maintain your gains, so to speak, you need to be training at that altitude. So next we're going to talk about metabolic, physiological, and exercise capacities at altitude. Now the stress of high altitude extremely restricts the exercise capacity and your physiological functions. So even when you're at a bit of a lower altitude, your exercise performance can deteriorate significantly because these physiological and metabolic adjustments cannot fully compensate for the amount of oxygen in the atmosphere at one time. So we talked about how oxygen levels decrease with increased elevation, and there are significant stresses that come in when you have a significantly decreased oxygen level. So it becomes a lot more challenging as you increase in altitude. So next we're going to look at maximal oxygen consumption, and this is related more to your VO2 max. So we actually start to see declines in VO2 max noticeable at 589 meters. So it actually doesn't take that long. You don't even have to go that high, and you can start to see a decrease in your VO2 max. After we see this small decline, the VO2 max will decrease by 7 to 9% per 1,000 meter increase. And that will stay about true till about 6,300 meters. And then once you get to the 6,300 meter mark, you're going to see even more significant decline. So, I mean, 7 to 9% is pretty significant already. But then once we get to these higher altitudes, like at 7,000 meters, your VO2 max will be on average about half of what you were doing at sea level. Men will actually experience the largest VO2 max decrease, and this makes sense because they have larger lean body masses, they have larger sea level VO2 maxes, and they have a low sea level lactate threshold. So because you have these higher levels of VO2 max, once you go to these higher altitudes, it's no surprise that you're also going to see a bigger drop off than, let's say, a female would. So here we go. This is a nice visual for you. You got the altitude down here on the x-axis. You got your percent decline in VO2 max from sea level. So it's showing you by percentage how much it decreases as you increase in altitude. So you can see that there's some people, once they get to 9,000 meters, their VO2 max is decreased by 80%, and that is massive. So this is a very, very high altitude, but the stress on your system is very, very significant. Now, exercise performance. So there are small improvements in endurance during acclimatization, despite the lack of simultaneous increase in VO2 max. And this is related to three factors. So you get increased minute ventilation because you're having to breathe harder and you're hyperventilating slightly. You get increased arterial oxygen saturation and cellular aerobic function. So we talked about how your system creates more red blood cells, it gets more hemoglobin, it can combine and extract that oxygen a little bit easier. And then you get this blunted blood lactate response. So we talked about how there's actually, beyond a point, there's less blood lactate created at altitude. Now, altitude exerts no adverse effects on events that are less than 2 minutes. But for longer duration events, there is poorer performance that occurs at higher elevations than at sea level. And this makes sense because we talked about how you have a higher reliance on your anaerobic system. So it would make sense that your anaerobic activity would not be affected as much. But when we talk about aerobic activity, you're going to see this massive decrease in performance. So the threshold for these decreases appears at about 1,600 meters for events that last 2 to 5 minutes. And we start to see decreases in performance at 600 to 700 meters for events that last greater than 20 minutes. So an example of this is if you did 1 to 3 mile run, this medium altitude of 2,300 meters would actually decrease performance by 2 to 13% in fit subjects. So running at altitude, doing any type of sport really at altitude is going to significantly decrease performance. Okay, so this graph is going to show us performance declines in relation to altitude. So we have these different lengths of races. So we have your less than 2 minute races, we have your 2 to 5 minute races in yellow, you have your 20 to 30 minute races in blue, and then you have your 2 to 3 hour races in red. So we're going to show you how much more percent of time that you need to spend to complete that race. Now, if we look at the less than 2 minute races, so let's say you were running like a 400 meter track race. And typically for elite athletes, that takes about a minute, maybe slightly less, to do a 400 meter race. And we can see that we don't see any real declines in the times at altitude. So people will actually be able to do that race pretty normally at altitude, even up to 4,000 meters. Now, if we were to run a marathon at altitude, and let's say an elite marathon runner can run a marathon in just over 2 hours. Well, it's going to take them about 30% longer to do that race at altitude at 3,000 meters because it is so stressful on the aerobic system. So it's important to know that usually performance, especially when it becomes aerobic, gets a lot more challenging at elevation. So next we'll talk about circulatory factors, and we've talked about this a little bit, and we know that with time at altitude you get increased hemoglobin, you get increased hematocrit, you get increased red blood cells, and so you have this increased capacity to hold oxygen. But why does VO2 max stay below the levels at sea level? Well, it happens for a few reasons. Number one, you just have a reduced circulatory capacity. You have this decrease in heart rate, you have this decrease in stroke volume, and because of that, you're not going to get the cardiac output that you typically would. So you're going to get less blood going to particular tissues, even though your ability to carry oxygen is a bit better. Now, another factor is one that we've talked about a few times, and it's the atmosphere having quote unquote thinner air, which does not allow oxygen to pass into your system as easily. So it's harder to get oxygen into your system, and then your heart is not pumping as fast or as hard as it typically would, and therefore you're not getting this increase in oxygen levels in your system. And so it's very difficult to get these changes in VO2 max. So we just talked about circulatory changes that are related to more resting state at altitude, and now we're going to talk about changes that happen during submaximal physical activity. So when you first get to altitude, so this immediate altitude response, with submaximal exercise, you're actually going to see an increase in cardiac output. Now you're going to say to me, well, Brett, last slide you just told me that cardiac output decreases. Well, it actually does. As you start to get acclimatized, you do not improve and you see a decrease in your cardiac output over time. You also see this progressive decrease in stroke volume as you stay at altitude, and this reduces the exercise cardiac output. So now we're back to what we talked about last slide, where your cardiac output actually decreases over time at altitude. With this lower cardiac output, the submaximal oxygen consumption remains stable through an expanded AVO2 difference. So I've talked about this a few slides ago as well, is now you have a decreased stroke volume, you have a decreased cardiac output. So how do you get oxygen to the tissues that they need? Well, you get better at extracting oxygen from the blood. So you have more hemoglobin, you have more red blood cells, so your ability to carry oxygen is improved, and then you get better at extracting that oxygen out. So this increased submaximal heart rate offsets the decreased stroke volume in submaximal exercise. So as you start to do exercise, obviously your heart rate increases. So this offsets your decrease in stroke volume and helps that cardiac output increase with exercise. So overall, it will be decreased compared to sea level, but it will increase as you do more exercise. Next is maximal physical activity. So when you're going full out, the maximal cardiac output decreases after 1 week above this 3,048 meter level and remains lower. So again, the cardiac output compared to sea level will be lower at altitude. Reduced blood flow results from the combined effect of decreases in maximum heart rate and stroke volume, and both decrease with the length and magnitude of exposure. So we talked about this already. In order for cardiac output to decrease, we need to see a decrease in heart rate and or a decrease in stroke volume. And at altitude, you're going to see both. So overall, you're going to see decreases in heart rate, stroke volume, and cardiac output at any altitude. And it will get more and more of a decrease depending on how high of an altitude you're at and how long you spend there. You also get this decrease in plasma volume, and you get an increase in total peripheral vascular resistance that contribute to reduced maximum stroke volume. And then you get enhanced parasympathetic tone induced by prolonged altitude exposure, which reduces the maximum heart rate. So you know that this decreased plasma volume happens because you also get this increase in fluid loss at elevation, and you also get this increase in red blood cell production and hemoglobin production that allows you to carry more oxygen. So increased hematocrit and increased fluid loss equals a decrease in plasma volume. So aerobic capacity on your return to sea level. So you went and lived up in the mountains, you did some training up there, you come back to sea level. What are we going to see? Well, your exercise performance actually doesn't improve when you're using VO2 max as your improvement standard. So if you're just going up there to improve your VO2 max, you might not see a big change there. You do see small improvements in VO2 max or physical performance at altitude and when you return to sea level, but that's more related to the effects of training and or repeated testing during altitude exposure. So as long as you're being specific to the activity that you want to do, you might see a small increase in VO2 max when you return back to sea level. So what are some possible negative effects to altitude training? Well, when we're exposed to prolonged altitude changes, we can negate adaptations that could improve our exercise performance when we return to sea level. Now, what are those changes that might happen? Well, we might see residual effects of muscle mass loss and reduced maximum heart rate and stroke volume that do not improve once you return to sea level. So if you have this muscle mass loss, well, now you've decreased your ability to elicit power depending on what sport you're doing. You might also have this reduced maximum heart rate and stroke volume, and that's fine, but it might not enhance your performance when you get back to sea level. And then you might also have a reduction in cardiac output at altitude, and that will offset the benefits that you get because of your increased oxygen carrying capacity. So even though you have more red blood cells and even though you can carry more oxygen, you also have a decreased cardiac output. So it might just level itself out and you might not actually see a massive improvement because of that. Now let's talk about altitude training and sea level performance. So we've kind of talked about potential negative effects, but we'll dig into it a little bit more. So acclimatization to altitude improves the capacity for exercise at altitude, and endurance training at altitude does not improve subsequent sea level performance. So if you train at altitude, you're going to be really good at altitude. But if you're trying to train at altitude to improve at sea level, you might not see a performance improvement at all. Altitude adaptations in local circulation and cellular metabolism and increase in the blood's oxygen carrying capacity should theoretically improve sea level performance, but we're finding that it actually doesn't. So this goes back to that specificity principle. If you need to train at altitude, then train at altitude because that will help you improve at that stage. But if you need to be training at sea level, then go train at sea level for your sport or event. So when we have these positive pulmonary adaptations that happen when we're at altitude, they actually stick around for a little while when we come back to sea level. So you'd think that would be beneficial to your sea level performance, but what we're going to find next slide is that's not always true. So let's take a look. Okay, so we actually see that there's no synergistic effect that emerges from combining aerobic training at altitude compared to training at sea level. And what we're going to see here is we're going to look at two different groups. We're going to look at group 1 in the yellow, and we're going to look at group 2 in blue. So group 1 starts by training at sea level, and we're looking at their VO2 max, and then they go to altitude and they train at altitude. When we look at the blue group, they started training at altitude, and then they came back and then they trained at sea level. And what you guys can see is that between these two groups, regardless of what altitude they trained at, they pretty much have the exact same VO2 max. Like it really doesn't matter a whole lot. You can see that this blue group improved slightly at altitude, but when they came back to sea level, they performed just as well as group 1 who trained at sea level. So you would think that we would see more improvements in this, and some athletes still buy into this method, but we're starting to see with more evidence that you want to train in the area that is most specific to the sport or event that you participate in. So altitude natives may respond differently. So what's an altitude native? Well, it's someone who was born at altitude, someone who's lived at altitude their entire life, someone who is well acclimatized to altitude. Now, for altitude natives, the total hemoglobin and blood volume synergistically increases with training and altitude exposure compared to sea level athletes. So this may explain their extraordinary endurance performance at altitude. So if you look at, let's take Sherpas for example. Now Sherpas are people who live in Nepal, and they have incredible endurance. Their ability to climb without any supplementary oxygen is incredible. And that is because they have lived there. They have experienced that. That is their normal. And so they have this um, improved endurance performance at altitude compared to someone who was born and lives at sea level. Now, there is a decrease in absolute training level at altitude. So the absolute workload must be lowered to perform aerobic exercise at the same relative intensity at altitude as compared to sea level. Now, basically what that means is if you are riding your bike at sea level and you can pedal at, you know, 500 watts at sea level, in order to do the same amount of work and the same intensity, you might only be pedaling at 250 watts um, at altitude. And the reason is if you tried to pedal at 500 watts at altitude, you'd blow yourself up. You would be feeling really, really terrible because you would be straining your system so hard. So in order to do the same intensity, you're going to decrease the amount of workload that you'll do at altitude. So at-home acclimatization, how do we do this? So number one, you could get this gamma hypobaric chamber. I'm guessing these are insanely expensive, but essentially what it will do is it allows you to sleep in it for about 10 hours a day, and they reduce the air pressure in the chamber so that you can get used to a particular altitude and the air pressure that would be at that altitude. The second one is simulating altitude at sea level by increasing the nitrogen percentage of air within an enclosed space. So I think there are different rooms where they can do this, where they can pump more nitrogen into the air. And nitrogen is the majority of what we breathe in with air anyway. If you guys remember, the partial pressure of oxygen is 21% in room air. So there's the capacity to decrease the oxygen percentage in the air by putting more nitrogen into it. And that makes it a little bit more difficult in regards to breathing because you're going to have this decrease in the percentage of inspired oxygen. And number three is a hypoxico altitude tent. So this is a tent that continuously supplies air with oxygen at about 15% instead of the 21% that's normal, and that lowers the inspired pressure of oxygen. So this is our normal value here of oxygen at 21%. They put you into this tent. They start pumping in different air that doesn't have quite as much oxygen, and you have to get acclimatized to living at or existing in a space that has less oxygen. All right, and finally, we're going to talk about altitude-related medical problems. So there are medical problems that are associated with reduced arterial pressure of oxygen. The first one's acute mountain sickness, and this is a relatively benign condition that just is a result of acute reduction in cerebral oxygen saturation. And if you guys remember that first graph that we talked about, you can see all the symptoms that happen with increased elevation and increased altitude. So that can be a product that results in this. Secondly is high altitude pulmonary edema. So this is when fluid accumulates in your lungs. And so not necessarily in your lungs as it's around your lungs and puts pressure on the lungs itself. And if you guys get into physiotherapy or any kind of health science, you guys will probably talk about pulmonary edema a little bit more in cardiorespiratory disease. And then you can also have high altitude cerebral edema, which is very serious. This is when the fluid accumulates in the brain. And this is a neurologic syndrome that develops within hours or days in those with acute mountain sickness. So it's an important thing to be aware of when you are looking at those symptoms, like how severe are they and what kind of changes are we seeing in that person, not only from a symptom perspective, but also from a physiological perspective. So that's the end of chapter 24, altitude training. Once again, we have the summary slides here. I'm not going to go through these one by one, and you guys can do that on your own time. I'm sorry this one took a bit longer than I was expecting, but again, I'm trying to give you guys some extra details. I'm trying to dumb things down a little bit for you where I can, because I know it can get a bit wordy in the slides, and I know it gets a bit wordy in the textbook as well. So I'm hoping that these explanations make a bit more sense to you guys. We got one more chapter left after this one, so just hang in there. We're almost home, and we'll see you for the next chapter.